With a population of around 1,000 million, give or take an Australian population or two, China is the largest nation on Earth. While her cities are huge, her masses are far-flung, covering an area greater than Australia. Life in the cities is improving. Standards of hygiene are slowly on the increase. Prior to the revolution, disease was rife in the hutongs, or alleyways as they're known. Epidemics of cholera and plague were almost commonplace. Infant mortality was high, and the people who dwelt here rarely lived beyond 45 years old. Conditions were miserable, and health care was unknown to the masses. In the countryside, conditions were almost as bad, with travellers from the cities often killed on the roadside for fear that they carried contagious diseases. The struggle to improve healthcare in China has been a priority of the communist regime. And while advances in industry and agriculture are just beginning to take place, already a healthcare program which covers every man, woman and child in the country is in operation. Until recently, China has relied heavily on her traditional herbal treatments, many of them more than 2,000 years old. They provided a basic but limited range of cures for everyday illnesses and injuries, but lacked the sophistication needed to treat serious complaints. But it's still the traditional techniques with more modern backup which provide the basis of the current healthcare program in China. The traditional methods, herbal medicine and acupuncture, are used by partially trained personnel known as barefoot doctors. They work in the fields and factories alongside those that they're called to treat. The basic level at which they work is in the production brigade, where they operate small clinics like this one. This brigade has 1,300 workers, and the clinic is staffed by 2 so-called barefoot doctors. They treat minor illnesses and injuries which occur in the day-to-day work of the brigade. This brigade is one of 14 in a commune of about 10,000 people. The 14 brigade hospitals pass more serious complaints onto the commune hospital, staffed by up to 50 doctors. The barefoot doctors who operate this clinic have had 2 years training in a larger district hospital and spend 3 months every 2 years doing further training in their commune hospital. They rely largely on herbal medicine and acupuncture. Occasionally, they use Western techniques. But the pharmacy here is stocked almost exclusively with Chinese herbs.
One fellow was robbing constantly banks and going to jail many times. So I asked him, "Why are you robbing banks?" He said, "That's where the money is, isn't it?" And this is where the action is, where the acupuncture points are. And so you must know exactly how they run, where in each channel 2, 3, 4 important points, and that's it. That's your acupuncture. And I will introduce you to the principles of treatment. The first stage of the principles I already told you. What is that? Wash your hands. Have you had your breakfast? Take the chot. Now, the next step I will tell you a little later. And that's it. Shall we go through these channels again? Yes. Make sure where they are. Lung, shout, lung, large intestine, U-turn, stomach, spleen. Right, 4. Next, heart, small intestine, in the back, urinary bladder, and coming up, kidney. Right. In the middle, we have pericardium. In the middle, we have sanjao, winding round the ear. In the middle, we have, yes, gallbladder, and coming up, we have, yes, liver. The 3 channels in the front of your arm, anterior surface, if you like to say, are yin. In the back is yang. And the 3 on the medial surface that are coming up are yin. The other 3 on the front, side and back are yang. Put all of your 3 fingers together. Right. Now separate your 3 fingers like this very well. and draw this line in front, right? And one goes to the thumb, one goes to the middle finger, one goes to the little finger. 3 channels. What are they? From lateral to medial, lung, pericardium, heart. Now draw that again from your chest, Right, 3. Everybody, lung, pericardium, heart. Those are yin, right? Now, they also refer to those structures above the diaphragm. What are they? What are the structures above the pericardium? Lung, heart. Structures above the diaphragm, all yin. And on the back, again draw those 3 lines. Large intestine, sanjao, small intestine. They are yang. Okay, shall we start again? 3 yin channels. What are they? Lung, pericardium, heart. The 3 yang. Large intestine, sanjao, small intestine. Very good. The 3 yang in front, stomach, gallbladder, urinary bladder. Excellent, no? And the 3 all coming very close to each other. Put your leg this way on the medial side. On the medial. What are they? Spleen, kidney, liver. Spleen, kidney, liver. Right. All the organs above the diaphragm, which are lung, pericardium, heart, are yin. Now you draw it here. What are they? Spleen, kidney, liver. In other words, below the diaphragm, the 3 solid organs. Spleen, kidney, liver. They are yin. Right? The rest of them are all yang. Once you understand this, that's it. That is the quintessence of where the channels run. Pick up your points on the way on these channels. That's it. Huh? The physiological effects pain relief or analgesia. Pain relief. The foremost point of pain relief, this one. Can you put your finger? Put your forefinger and thumb together like this. And the highest point is called hoku. The meaning of the word hoku in Chinese means the great eliminator. Hoku. Eliminates pain and everything else. In fact, that is the most widely used acupuncture point of all time. Hoku. Now you may ask, why? Why? The reason is this point called hoku, large intestine 4. In the large intestine channel, it is the 4th point. The answer to that is that is a cross-section of your spinal cord, and this is the afferent fibers coming into the spinal cord. These are called the C fibers. They are small, non-medullated fibers. They carry pain. These are the A fibers. They are large, medullated, and carrying non-pain. And they go to this common place, and in this area, which is called, it is a gelatinous area, discovered by a man called Roland, a Frenchman, in the last century under the microscope, substantia gelatinosa Rolandi, in Latin, Rolandi. Substantia gelatinosa of Roland. The two inputs come in and they meet each other headlong. They crash and they cancel each other. You understand? The pain and non-pain. The pain is produced by disease or by any surgical experiment. The acupuncture needle produces the non-pain. A are the large fibers, C the small fibers. This area serves as a physiological gate, and that is called the gate control theory of pain. Gate control theory of pain. Gate control theory of pain. Two people, Ronald Melsack and Patrick Wall, working at the Massachusetts Institute of Technology in 1965, MIT, put forward this theory, which explains how acupuncture works. There is some pain going, and you put the needle, two impulses going in, one overcomes the other. And that is the gate control theory of pain. There are also, from the internal organs, there is a pain coming. From the internal organs, right? These are the internal organs. Viscera, that is the B fibers. Also the same thing happens. And if you have pain of appendicitis or whatever, colic, you can overcome it. Three sizes of fibers, A, B, C. Large, intermediate, small. The reason why Hoku is the most effective point is because we need a large input. Every muscle is 60% an afferent structure. When you squeeze the muscle, when you stimulate the muscle, when you stretch the muscle, afferent impulses go. It's not only a motor structure, afferent. In every motor nerve, not only impulses are going that way, it's coming the other way. And why this muscle? What controls the Hoku? Abductor pollicis. You can see what you can do with this. To oppose the thumb. Long time ago, we were animals like frogs and monkeys and donkeys. You remember the time we were doing that, going on all fours. Suddenly, the dinosaurs came. There was not enough to eat on the ground. We climbed up the trees and we developed our tail so we wouldn't fall down. Then after the Jurassic era was over, we came down. The grass had grown and there were predators, our enemies, the leopards and the lions and the bears to eat us. So we had to look over the grass. We developed a bipedal gait to walk on our two legs. Our pelvis got strengthened and consequently the women had problems bearing our children. Our feet evolved to balance ourselves. And our voice evolved, our brain got a little bigger. We are able to shout and frighten all the other animals, and man became lord of the jungle. Now lord of the concrete jungle as well. And what is more, this is the most important thing that helped us to evolve, so that we could throw a stone, we could throw a spear at our enemies. The evolution of the hand, all due to this one muscle. Throughout evolution, if you ask what is the one main thing that helped us to evolve, is this one. That is the priority number one. This muscle has more than 250 deep pressure receptors per gram of tissue giving afferents. That is why you get the maximum input from this muscle, and so the hoku. Acupuncture points are motor points of muscles. If you are a physiotherapist, if you are a rheumatologist, we all study motor points because we have to do muscle testing, electrostimulation. The ordinary doctor doesn't know anything about motor points. It's too complicated for him. You better learn acupuncture points. That's much simpler where they are. So that is why this is the greatest eliminator. Likewise, in the foot, we have, that is my foot. That is my foot. My foot. We have the same point I told you is the point called Tai Chong liver 3, which has the same properties. 2 inches or 2 chun. Chun, C-U-N, means body inch. So this point liver 3, it has all the properties of Hoku. One is a male point. Hoku is yang. Liver 3, the name is Tai Chong. Tai Chong. If you want to know the name, that is the female point. Tai Chong, liver 3. Female point, dangerous. Normally a woman, the wife, the mother is the very calm, quiet, very pleasant, doesn't get angry, you know. Normally the man is the boss. Instead of liver 3 Tai Chong, we use another point regularly which is quite safe, a close point, that is called nating stomach 44. Half chun proximal to the web between the second and the third toes. So therefore, we have 1, 2 points. And the point large intestine 4 can be used not only in pain relief, in diabetes, in high blood pressure, in fever. You name it all, it can be used. And the liver 3 is an equally, if not more effective point in all disorders that you can imagine. But we have to be careful. If you are using liver 3, put the patient flat on the ground, flat on a bed, or wherever. Somebody stays close by to the patient. Not always, but occasionally you can get overcorrection of conditions. So those are the 3 main analgesic points. There is also another point which is for the face and head and neck area. Put your finger on the outer canthus of your eye, the outer canthus. Draw a vertical line very slowly, and you feel going over the bump, can you feel, of the face, and the depression under that. That is the prominence of the zygomatic bone, and this is the depression below the zygomatic bone. And that is a very important point. You can press that and see and circle it. You get a bit of a sickening feeling, right? And you can have tooth extraction. for example, with that. Alpha light only. Upper. Why? When I open my mouth in about 1-2 minutes, and I break it. Yes. Harry? Perfect. Very good. Hold it up. Perfect. Thank you. I will give you one more point which is very interesting. Take your hand like this. Right. Bend it into right angle. All right? You bend it into a right angle. At the outer corner of this crease is the large intestine 11, which is a homeostatic point. Now you draw your line from Hoku to there. Hoku, you remember? And that is your large intestine channel going up. Tuchun, 1, 2 of your thumb or 2.5 fingers below or distal to that is the acupuncture point, which is called Shao San Li. Shao San Li. Large intestine 10. Finger pressure in Japanese is, what is it called? Shiatsu. 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 And that is a very important pain relieving point. Headaches or backaches or whatever pain. That is the Hoku. For animals, that is the Shiatsu Hoku. So you have now a number of points for relief of pain, but the greatest of them all is Hoku. The second important thing is called sedation. And we said there are a number of acupuncture points we identified in the morning, which are these are the main sedative points. We have already mentioned this to you in the morning, and I'll come to them one by one. What is the cause of the sedative effect? we explained the pain on the gate control theory of Melsack and Wall. Today, there is a cloud over Melsack and Wall because many people believe that Melsack and Wall is not a complete explanation. That is called the neural or neurological theory, the gate control theory. But how was it disproved? It was disproved in the following manner. In Shanghai, they took a rabbit. Can you understand my rabbit? That's a rabbit. They put this rabbit in blinkers. You understand? They put this rabbit in blinkers. This is all done way in the 1960s. They hung this rabbit from a hammock. You understand? From a hammock they hung him. They put a point source of light, that is a strong bulb connected to a battery and a switch, and they put this bulb and they covered it up, and so only there was a point source of light going to his nose. And they started a stopwatch. Very simple experiment. Did you understand the setup? Rabbit hung on a hammock, blinkers, electric bulb, point source of light, stopwatch. They started the stopwatch and immediately, same time, they put on the switch. And as the nose gets hot, he starts jumping. You understand? And they found that in about 5 seconds, of course many rabbits are repeated, 5 seconds, that is the threshold of the heat he gets. Simple experiment, you can do it home. If you can't find a rabbit, catch your dog or cat, you can do it. If you are, or your neighbor's dog. No? After all, it's for a scientific experiment. Then what they did was, they put a acupuncture needle into the leg at the Susan Lee point, stomach 36. I'll come to that point later. They did that for 20-30 minutes. And they repeated the experiment, and they found 20, 25, 30 minutes or more. The rabbit is able to wait without jumping. The pain threshold had increased 3, 4, 5-fold. You see how neat it is. What did it show? That acupuncture, the A fibers overcomes the pain. Gate control theory, QED, proved. Absolutely proved. Then what happened? Then, this is the way with scientists. They prove something, and next stage they disprove the same thing. And you know what they did? They took another rabbit, second series of experiments. This same rabbit's brother, you understand? His brother, his own brother, they took him. That is his brother, right? That is rabbit B. That is rabbit A. That is rabbit B. They hung him from the hammock. We start again now. Did the first experiment. What is that? Showed in 5 seconds he starts jumping. Second round, they didn't give to this rabbit. They gave the acupuncture to this rabbit. And they transfused his blood or his cerebrospinal fluid to this fabric. And they found when they were acupuncturing B, A was getting the acupuncture effects, the pain threshold was going up. Now what the devil do you make out of that? That's right, there. Who said that? I say you are answering all the questions. Very good. Give him a big hand. They didn't say endorphins. See, they didn't say endorphins. You are quite right, you answer. But what they say was some chemical was going here from the blood or cerebrospinal fluid. And the entire concept changed, that there is something produced by the acupuncturing effect in the chemistry of the person that is also producing the acupuncture effect. So today we have the neurohumoral effect. For 30 years of medical research, scientific medical research, published in brain journals, neurophysiological journals, the International Journal of Physiology, more than 500,000 research papers. This is the story. The story of how acupuncture works is as follows. That is your skin. Skin. These are your muscles. Muscles. That is your spinal cord. Spinal cord. That is your basal ganglia. Basal ganglia. Thalamus, reticulo formation, red nucleus, all kinds of things. And your cortex of your brain, where you are thinking and feeling. That is your brain stem. That is the pituitary. Pituitary. Hypothalamus. Thalamus, hypothalamus, pituitary. That is the brain stem. Those are the more important parts of your nervous system. The pain you cause, that is your pain, goes to the skin, from there to the spinal cord, through the ascending pathways to the basal ganglia. Where exactly is the pain center? We do not know where the pain center is. If we know, when people have intractable pain, secondary cancer for instance, trigeminal neuralgia, causalgia, phantom limb pain, we can do stereotactic surgery, remove the pain center. We do not know. There is a presumption that it is in the thalamus somewhere, in one of the thalamus centers. We do not know, but we know something very important. Although it goes to one of the basal ganglia, the actual appreciation of the pain is in your cortex. And it all depends on how you interpret it. You understand? On how you interpret it. It's all chemicals. This is the biggest neurochemical electrical computer in the world. As Stephen Hawking said, well, let us try to understand it, then we will understand the mind of God. So this is the neurochemical theory. Today, we are getting a little away from this neurochemical theory, although this is the latest in science to explain how acupuncture works. And the reason is we are distancing ourselves because one modality, that is laser for example, which I shall show you, laser therapy works. There are no neurals, there are no chemicals, there is no nothing. It is working very well. Therefore, today, it is not the cause and effect, it is the effect and the cause. We believe that these neurohumoral changes are the result of acupuncture and not the cause of how acupuncture works. They are probably the result of it. And the evidence for it is that there are many substances with which you can neutralize these endorphins, morphine-like substances. There are many anti-morphine-like substances that you use. For example, if you give too much anesthesia, what do you use to counteract that? Naloxone, very good. Now if you give naloxone, you can't produce the acupuncture effect. It has been demonstrated in many, many laboratories. You give naloxone, no acupuncture effect. But on the other hand, if you start acupuncture, then give naloxone, nothing, the acupuncture continues. So that some people believe that the endorphins is only a starter. It's much more complicated than that. It is like if somebody is watching from outer space, or a spaceman, extraterrestrial comes and watches me starting my car. He doesn't know, he has never seen what a car is like. He sees my key going into the keyhole and he reports back on his fax machine back into outer space. There is a man who came, black man, he brings a small piece of metal, he puts into a hole, and that is why the car goes. Cause and effect, it looks like that. There is a heap of other things. There are things down I press, that is why it goes. There is things that are turning, and most importantly in the back there is a fluid called petroleum, it works. You understand? This is like the simple key explanation. Probably there is a whole host of other happenings, and that is the explanation. So we must understand more about our bodies before we know how acupuncture works. It is not as simple as we can make that out to be. If you sit there very, very quietly for the next 3,000 years, I'll try to come back and tell you how acupuncture works. This is, as of today, the kind of kindergarten explanation we have. It's a fairly reasonable alibi, but most certainly not the whole story. Put your finger at the lowest point of the yellow, highest point of the yellow, and extend it to meet the midline. It is a simple method. All your methods, what you told, are good, but you have to be 100% precise. But I missed one word. You have to say, extend it upwards. You know why upwards? Because some idiot might extend it to the midline down here and put the needle there. And this is how you do it. Right, this is my acupuncture needle. Can you see? That is my acupuncture needle. I don't want to touch the hair of the patient. He come on motorcycle, he may have dust. So I have washed my hands, I smile at the patient. May I have your chun? I take the chun. I take my needle, that is my needle, and I just run it over his head. You see that? It is as simple as that. Got that? Okay, you don't have to mess around with his hair and do it. My needles are here. Pahui do 20. Now when you put Pahui do 20, sometimes in many diseases, it is not enough. You have to boost the sedative effect. There are 4 points, all one acupuncture point. One chun lateral, one chun anterior, one chun posterior. It is called extra 6. The word extra is used for points which are or were discovered long after the points were discovered in the channels and put into them in the Yellow Emperor's textbook. In other words, this is where they are. Can you understand my diagram? That is the middle point. 4 points, one in front. Can you see that? Pahui in the center, one chun lateral, one chun anterior posterior. That is called extra 6 to boost it up. Cis and song. Cis and song. 4 mental wisdom. This is the Pai Hui, which means the meeting point of 100 points. This is the meeting point of all other points and channels. The heart and pericardial channels run like this. In the morning I told you how the lung channel runs, like this, to the thumb. Pericardium to the middle finger, the heart to the little finger. And at the wrist crease we have a point called Shenman, and at the middle, in the pericardium, Tuchun proximal, we have a point called the Nequan pericardium 6. These are all fire points. These are all fire. And to neutralize the fire, we have a water point. That is the water point. You take the outer side of your leg. That is the outer side of your leg. That is your lateral malleolus and outer side. Half a chun below is the point Shen Mo. It is also God point. Shen. Unite UB 62. These are the important sedative points. I repeat again, hysteria, epilepsy, mental disorders, anxiety disorders, depression, schizophrenia, insomnias, behavioral disorders, cerebral palsy, addictions, heroin, alcohol, all we can treat very effectively. Sedative points. There is one set of more points, especially if there is insomnia, and that is behind your ear. That is your ear. That is my ear, my left ear. That is the lobe of my ear. That is hanging down. There is a bone, very hard. Can you feel that bone? Behind your ear. It is hanging down like a nipple. Can you feel that? Like a nipple. Behind the ear, the bone. And at this point, there is an acupuncture point. That point, there's acupuncture point. You connect this point. Middle is an acupuncture. And the middle is an acupuncture. This is the gallbladder 20. This is the Sanjavo 17. Extra 8. And that is the extra 9. These are two very important points over the mastoid. Extra points, extraordinary points. And they help you to sleep. If your child or anybody is not sleeping, if your husband, wife, just rub her and tap her there, he or she will go to sleep. Very well. They are called, in Chinese, they are called Anmian. Anmian 1 and Anmian 2. Anmian. What is the meaning of Anmian in Chinese? Huh?
Good sleep.
Yes, very good. Have a good sleep. Anmian 1, Anmian 2. Extra 8 and 9 means have a good sleep. So those are the sedative points of the body. Very important in an entire group of disorders. I have told you how to treat your entire psychiatric group of disorders. Anxiety, hysteria, epilepsy, mental disorders, insomnia, anxiety, behavioral disorders, addictions, cerebral palsy. Question, heart 7. Explain where H7 is. Shenman heart 7 is here. Can you understand my diagram? Right. There is running a tendon here. You know the name of this tendon? Yeah? Very good. Flexor carpi ulnaris, and it is attached to one of the bones of the pisiform bone. I say, at this junction and the crease is Shenman heart 7. Let us go through this again. Put your fingers there. Pa Hui do 20 sedative points. Right, this way, there. Pa Hui do 20. 4 needles, season song, extra 6. Ne Guan, we show you doing that way. Pericardium 6. Shenman, heart 7. Shenmo, UB 62. Unmien 1, Unmien 2, extra 8 and 9. Those are the sedative points. I cannot go away from here without giving one first-class sedative points in the year, although we take it. Although we are not doing auriculotherapy, I would like to give you that point as well. Right now, because they all come together and we use them very often in tandem. The ear has over 200 acupuncture points. And if your body acupuncture fails, we use auriculotherapy. Your ear looks like this. You know the different parts of the ear? What is this part hanging down? Very good, lobe. Right. What is this round? That is called helix. If that is the helix, this is the antihelix. And the antihelix splits into two, superior and inferior crux, and where the junction is the point Shenman, ear Shenman. That is the center point of the ear. Very good sedative point. Usually what we use is a press needle. When the patient goes home, you want something to keep the patient off the pain and sedate and so on. You put a needle that he carries it home for 3 or 4 days. That is called a press needle, I'll show you. And that is the point, Shenman, that is very important. While I am getting the press needle, this area that is deep, through which the sound goes in, it is called the cavum concae, that is called the Kimba concae. And do you see at the 2 o'clock position, I have drawn here, 2 o'clock position of the ear, a little prominence, right? There is a thumbtack type, but you have to be very careful. It has been known to damage the cartilage of the ear. There is a ball type, which is quite safe. It comes in gold, steel, or silver. Gold, steel, or silver, and the gold is tonifying, the steel is neutral, and the silver is sedating. You can use mustard seed. In my clinic, we buy a handful of mustard. We use it for 5-6 years. One of those. There is also a magnetic type that you can use a magnet over it and stimulate. It's highly sophisticated. I use in my clinic very simple mustard seed. So that is sedation. Homeostasis. Homeostasis is the balancing and the yin and yang balance, and we have one very good point. What is that point? At the outer end here, we have already discussed that point. Chu Chi, large intestine 11. At the anterior elbow crease, large intestine 11. That is my elbow. At the outer end is there. You remember I told you about the shiatsu point. That is the large intestine channel, and that is the 10, that is the 11. That is the best known homeostatic point. It is this point. C7. Vertebra prominent. The name of the point, anybody knows? Yes. What is the name? That is a number. Yes. Do 14 or GB 14, governing vessel, or do means governor. The new infections that are coming, there are a lot of them antibiotic resistant. If you are looking at acupuncture, there it is, do 14. take that point, you can use it. And together, anti-allergic, anti-inflammatory, we have another point called Shui Hai. This is called the Sea of Blood, spleen 10. I want to show the Shui Hai point. I keep the middle of my palm on the middle of a patella. There. Can you see? Middle of patella. And where the tip of my thumb is, that is the point Shui Hai spleen 10. Got that? I repeat it like this. There, this side you can see, like this. That is also another very important acupuncture point, and that is called Liang Chu, stomach 34. Tonight if you eat anything and you are having diarrhea early hours of the morning, you put your finger on those 2 points outside. That is called the Shicklef point, or the point for acute disorder. Stomach 34. Now again put your hand like this. And this time don't worry about the thumb. You understand? And I now put my hand, the wrist on the top of the patella. The wrist on the top of the patella, right. There. And that is another very important point. That is the motor point of the cordyceps. Not exactly cordyceps, one part of the cordyceps. Very important because osteoarthritis of the knee, stroke, walking, knee injuries, footballers, sports, fast bowlers, muscle is weak. That is where you develop it. Put a needle there. Right, the motor point, very important point. And one more point which you must know in this, I'm dabbling in this area. Can you feel the head of the fibula? Feel the head of your fibula. And the head of the fibula is like this. Right. And at the neck here, gallbladder 34. We were talking in the morning, liver 3, gallbladder 34. This is exactly where this is, anterior end of the neck of the fibula. Very important point. And this side, very good. Got it? This one here. Gallbladder 34 is the influential point for muscles and tendons. Muscles and tendons. And in any muscular disorder, the entire rheumatic disorders, the entire locomotor disorders, you will be going in search of that. Now, give me a little thicker one. Yeah. I am using a point, you know, in your horoscopic, that is your heart line of your horoscope, and at the end is a small intestine 3. Now this is a very interesting point because if it is due to muscle spasm, we should get an improvement. If it is due to a mechanical disorder, like a disc or any other abnormality, we are not going to get any improvement. Not strong? No? See, he's not strong. You see, not strong? Okay. Too deep. See, he's a very person with a very high pain threshold. Right? You go up there like this, thank God, and go down and see how much you can go down. Yes, again, right. Right, okay. See, touch this one. See, there is a significant improvement, you can see. Therefore, a fairly significant amount of his problem is due to muscle spasm, thank you. So we have to take that into account, and mobilizing exercises and some chiropractic to stretch it can also be added. When you see a man with a lumbar spondylosis, prolapsed disc, back sprain, right, you try this test. Very strong stimulation, and that is the confluent point for the do channel. The do channel, and that is called small intestine 3. This one at the end here, a strong stimulation. My job is to show you what are the points I use. Is it on your left leg or right leg? Right leg. This is what I do. Normally the first day I don't do more than 1 or 2 points. I find the most painful place and do it. First day I may try this point to see how much of it is due to muscle spasm. I know that there is a significant amount due to muscle spasm which can be relieved. Massage and manipulation and stretching will be indicated very much in his case. Now, Dorian, can we have some? I use the point, my first point is this one. What is this point? Yes, do. Yes, give me the one chun. I'm using Manchun needles. About this, Dr. Dorian will tell you later. See, I'm not used to this kind of stuff in this, but today I'm using them. There, that is the governing point. Can you tell me where you have pain? Any special place that gives you pain? There, huh? Yep. There. There? Yep. There. That is where the rheumatologists use hydrocortisone, and that is called an RC point. Am I right? Correct place? Is it correct where you had pain? Yep. Okay. Then, what is the number of this point? What is the number? 20. Right. Long one. How long? As long. Yes, as long as possible. Now, you see his sacrococcygeal joint. Can you see that? Can you see where the sacrum meets the coccyx? And can you see the highest point of his trochanter? Right. I draw that line. Junction of the outer third with the medial 2/3. You see the needle? 4 inches. Yeah. Is that the longest you got? Yeah. Yes. I put this needle. Right. Now, there, that is how it's very simple. Huh? You watch his face. Can you feel anything? Can you feel anything? No. Now? Now? Now?
Yes.
Now, right. What did you feel? Can you describe?
Like a small electric shock.
Say that loud.
Like a small electric shock.
Like a small electric shock. That is called acupuncture sensation. Now translate that into Chinese. Chi, meaning small electric tumor, I mean. What is, yes, the same as small size. That is called Chi. What is Chi? Numbness, heaviness, soreness, distension. Right, you see that? Fast needling. Not uncomfortable. Huh?
No.
No. Right, that is the art of the acupuncturist. That is what you must cultivate. You can learn most of acupuncture in about 1 or 2 days. But the art of needling is a lifetime job. You see, I messed it up needling myself. I used the wrong hand, right? Right. There. Number of this is 20, this is 30, this is 40, this is 60. 20, 30, 40, 60 with the RC point is the cocktail. And if you give me one more, normally I don't put more than 2 needles, at maximum 3 needles. But he has already been needled, so that is why I am giving you the full length of the stuff, so that I am able. That is his hoku. Can you see? That is his hoku. Hoku. Enough. Governing point, asha, or painful point 20, 30, 20, 30, 40, 60. And now we are going to give him electricity. Low frequency is all what he requires. About 10 to 15 hertz, that is the alpha rhythm to secrete his endorphin. That is all what we do 5, 6, 7 days, and a little massage and stretching. Much of his problem is due to muscle spasm. He will also benefit by some manual medicine. I will show you what we have done. Very good. There you are. Governing point, Asha point, GB 30. GB 30, 20, 30, 40, 60, and the pain point. Now Asha, what is Asha in Chinese? Yes, what is the meaning of Asha? Asha. Asha. How do you say oh yes in Chinese? Asha. In Mandarin. That is oh yes. You ask the Chinese patient where is it hurting you and start pressing. That is the Asha point. He says oh yes, oh yes. That is called the Asha, right? And don't press it too much, the patient will start shouting like that. This point. At the end of this crease, we have a point which is called Hoshi, small intestine 3. There is a group of points called confluent points. These are all used by very high-powered acupuncturists, and I am not one of them. But this one I use fairly regularly. I find it very useful in backache. When somebody comes with very acute back problem, right? I lifted the flower pot on the weekend, I'm having acute back problem. This is the answer. And it goes.
How far does it go in?
It goes in to hit the bone, and that is your metacarpal. But sometimes you can't get it as far as the bone, don't get it as far as the bone. And this is a fairly painful point, very uncomfortable. Look at the patient's face, that is the most important. This is also, look at the patient's face and ask him what you feel. What he feels is called Chi. Chi is it is pronounced with a T sound, Chi. Chi is the equivalent in English is acupuncture sensation, is numbness, heaviness, soreness, distension, and irradiation of one or more of these sensations along the channel and or the nerve. He described, he says, I felt like small electric shock. He's a very clever, intelligent man. He can convey his feelings correctly. Many people say, I feel something. That is Chi. And it is very useful to produce Chi in this instance when he has pain, because the Chi relieves him of the pain. Now let us discuss what we said about the physiological effects of acupuncture. What are they? Number one, analgesia. Very good. What are the known analgesic points? Hoku. If you remember that, I am very comfortable with you. That's it, all you want to know. How do you locate it? Forefinger and thumb together at the highest point. On the other hand, you draw your finger along the second metacarpal, like this. Second metacarpal. Can you see? And the midpoint there is also another Hoku. And that Hoku is the first dorsal interosseous motor point. And it is called surgical Hoku. Surgical Hoku because it is more effective for surgery and acute pain. So there are two Hokus. Third Hoku, which is called an Ekiwa Hoku. And all these three are important because you are here for one main reason. That is because all the known methods of pain relief in other medicines have a shortfall. You will agree with me on that. Not that acupuncture can do everything. Therefore, we are looking for anything that works, never mind the theory. And acupuncture also is a well-known method to work. Therefore, one of the main reasons why you are here is you are looking for pain relief. Remember, 65% of the patients that come to you are coming for no other reason than they are having pain. Doctor, I am having pain here, pain there. Why that doctor came is he was having pain and stiffness. He was suffering 24 hours. Pain in the back, pain somewhere else. If any of these things they did not have pain, my God, we will be without job. Thank God, God created pain specially for our benefit. Of course, it is a protective mechanism to the patient as well to seek assistance of the doctor. But it is not as simple as that. When you say it is a protective mechanism, why is a woman having pain during labor? Nothing protective in it. Why are we having pain in migraine? If you remove the pain, there is no disease. Trigeminal neuralgia, remove the pain, no disease. Causalgia, no pain, no disease. Phantom limb pain, no pain, no disease. If you say pain is protective, then the proportion of pain must be directly proportional to the threat to your life. Have you ever experienced a severe toothache? Right. And it is not, there is no threat to life at all, but it can be very severely painful, disabling. So that pain is a puzzle. It is not as simple as we say it. What is pain? Ask the Queen of Spain. 6 months pleasure, 6 minutes pleasure, and 9 months pain. A little rest and at it again, said the King of Spain. That is the pain of labor, right? We don't know. It's very difficult. Pain is a very difficult phenomenon. And I am now telling you about the hoku. This is the thumb. That is the thumb, number 1. That is the forefinger, number 2. There are muscles in between them, 2 muscles. I told you yesterday about the adductor pollicis, first dorsal interosseous, and the nerve which innervates adductor pollicis. What is the nerve? Which nerve? Ulna, very good. You see the ulnar nerve goes along here, under the pisiform, under the retinaculum, divides into 2, and the deep branch goes all the way to the adductor pollicis. Now you may ask, why couldn't it be put by the median nerve? See, this hand is one of the greatest engineering marvels in the world, in this universe, how we use this. Because from this side, it gave the nerve supply and median nerve on the thenar eminence so that you can coordinate the entire hand, ulna, median. And therefore, the deep branch of the ulnar nerve. And that is your proper hoku. Hoku Li4. The surgical hoku is in the middle here. That is the of this muscle. That is the median nerve. This is the classical hoku. This is called the classical hoku. then there is another, we take this metacarpal and I will enlarge it for you. And what I will do is, I will outline the various areas now you understand it. This is called, this whole thing is a hoku. It is called the ekivo. This is a modern neurophysiological hoku that has been described in recent times during the Cultural Revolution. Ekivo. Ekivo means embryo containing information of the whole organism. It's a modern hoku. Embryo containing information of the whole organism. It means from our embryo we are split into some 100 trillion cells. Each cell in its genes, in its chromosomes, carries the entire impression of the organism. The day will come, all I want is one cell from you and I can clone you completely. Very soon coming. They're already doing it with carrots. They're already doing it with many, many different plants. You know that. Cloning is already happening, and it is a very effective method because you are taking a very good species, a good breeding, and you are going to clone. So all those of you who are well bred, we may clone you for sake of society. And that is the ekivo. And these are the different parts of your body. If you have a headache, you can put your needle into the headache area, abdominal pain, foot pain, arm, neck, and so on. You put it right into the periosteum and hit it hard. The patient almost cries in pain. That is a method which is called periosteal puncture. You can use it at this point or several other points in the body. Hoku, what are the other analgesic points? In the foot. Very good. Tai Chong, liver 3. But it can prove to be dangerous. Therefore, we take the other nearest point. Very good. Nating, stomach 44. So once again, analgesic points. Hoku, Tai Chong, nating. We can also use this point. What is that called? Chuan Liao. Small intestine 18. You remember you saw me doing this, something like this? He was going to pull my tooth and do something, so I was doing, right? You remember that? It's very effective analgesic point. And then I told you about another point. Yes, Shiatsu point. Yes, Shaosan Li. That's right, large intestine 10. Now, in one shot, shall we go through the analgesic point? This is your bread and butter, right? Remember that. Pain. Right. Put your finger, Hoku, large intestine 4. There are 3 of them, but remember the classical Hoku. Tai Chong, liver 3. Nating, stomach 44. Shaosan Li. Chuan Liao. As far as possible, unless you are doing surgery, don't use all of them. Use only one. Remember. Because you don't give aspirin and Panadol together, do you? No. Aspirin is aspirin, Panadol is Panadol. You decide what to give. But here are the different possibilities. The next is, we talked about endorphins and enkephalins, if you believe in them, hydroxytryptamine and so on. The next effect is the sedative effect, which is the points. Put your finger. Pahui, do 20. What are the 4 points? seasoned song, 4 mental wisdom, extra 6. Then we said heart and pericardium channel. Naquan, we showed in that lady doctor, Naquan pericardium 6 sedative point. Shenman heart 7. You remember we talked about pisiform bone and so on. And Shenmo UB62, where is that? Yes, half chun below the tip of the lateral malleolus. You know where the bladder is running. And we also said for sleeping there are 2 points. What are they? Unmian 1, Unmian 2, extra 8 and 9. And in the ear, what is the point? Shenman. And make no mistake, because all the time you will be using this point, Shenman. Take your neighbor, borrow your neighbor's ear, check on it again, because this is deadly important. There. This is the point that you will be all the time using, either as a press needle or even to needle. Right. That is called the antitragus, superior and inferior crust of the antitragus. And that is called, I bring this here, this triangular area is very important. And I bring this here, that is the triangular area. In this triangular area are 3 important points. That is the Shenman, that is the blood pressure lowering point in the 3 angles, that is the sympathetic area. You can use for asthma and so on. And that is the Shenman, which has all-purpose point. So that is the sedative effect. The next, you see the triangle? That is the triangle. Lower and outermost point is Shenman. Uppermost point is blood pressure. The point at the anterior and lowermost point is the sympathetic. Finally, we have the motor points. In any motor disorder, we use the motor points. You remember I showed you on the same lady, neck futu, femur futu. You remember 6 chun above the motor point of the quadriceps. Which portion? Rectus femoris. And those are the important physiological effects. But over and above that, I said psychological effects are very important. Right? Psychological effect is you create it by the ambience, by your empathy, how you set about it. You always give a lot of confidence to the patient and say, don't worry, we will produce the result, however bad the case is. Don't say, oh no, most of these people don't get well, I'm sorry about this. Because remember, it does not start at the needle, it starts in the mind of the patient. And you are the greatest placebo. You put on the mantle of God and show your mandate, that is the certificate from the Almighty, and say, I am the person, I am your doctor. You must create the confidence. I tell all my patients I am the best doctor in the world. And they believe it. They have to, because otherwise they won't be with me. If he's the best doctor, they must go to him. People don't never go to the second best doctor. I tell them I am the best doctor in the world and I can cure all illnesses except the incurable ones. And they believe me too. See? And what is more? What is more? See, lots of people are feeling better or getting cured. Some people there will say, I am not getting better. Then I say, nothing wrong with my medicine, see? Otherwise these people can't be getting better or feeling better. What is wrong with you is your bad karma or bad fate That is why you are not getting cured. Nothing wrong with my medicine. Anyway, don't worry. Even if you die of this disease, according to our beliefs, you are getting reborn. I'll try to meet you in the next life and cure you. There was one surgeon, he was going round the ward, very complicated operation. So the next day was the operation. He spoke to the patient, and the patient in the meantime had been inquiring from the nursing staff and from other patients, and they have told, my God, this is a serious operation. Everybody we know had died from this. So the surgeon came and said, hello, good evening, tomorrow morning is your operation. Doctor, can I have a word with you? Of course. I hear this is a very serious operation. Yes, he's very serious. I hear many people die. Yes, he said 99% of people die. Oh, doctor, then how do you know? No, in your case you will be all right. You will perfectly well, you will recover. How do you know that, doctor? He said, I already operated 99 people, they all died.